So the best way to make students feel welcome on the ward is by involving them in the ward round. Specifically allowing them to write in the notes is really helpful, and also review the drug charts and just talk through what drugs the patients are on. Also, a really good thing is if the students have an opportunity to meet the patient beforehand and then present the patient to the consultant. That's always really helpful. It's really important for them, for clinicians, to show the students around, let them know where they can leave off their bags and coats, let them know the code to the staff room if possible, let them know where the bathrooms are, and provide them with scrubs, etc. if they need to wear them. In order to find jobs appropriate for students, if the clinicians ask the students before they began what their learning outcomes were for this year, and checked their level, like what year they were in. And that will allow the clinicians to pitch at the students' level and know what jobs are expected of them, such as if they can do ABGs, cannulas, or if they're just better off doing observations. If the doctors think they're too busy for the students and they don't think there's anything to do, it's always important to encourage the students to go and ask the nurses, could they maybe help them with observations, because observations occur really routinely and really often on most wards. So and it's very beneficial for students to improve on these skills as well. Any job that the healthcare assistant might think that might be boring for the student is always going to be helpful, such as ringing microbiology for some results, taking some bloods to the lab, or just doing general jobs is always a good way for students just to learn how the ward works. If you ever want a student to complete a task, it's really important that you say it clearly, and maybe by getting the student to just say back what you've asked them to do, just so that they're completely 100% sure before they go off and see the patient. So if a student ever does complete a task for a doctor or a nurse, like history or an exam, it's really important that they're viewed whilst they're doing the history and exam, and also that the feedback that they get is constructive feedback, and it's probably best given in a quiet side room or in an office where they have time to actually go through what the student's done well, and address maybe some issues that the student might have, just so that they can better themselves for the next time.